Good afternoon. My name is Shelley Stein, and I am the chair of the Genesee County Legislature, and I welcome you today to the Genesee Orleans Live Weekly Health Department briefing. I am joined today by Orleans County Chair Lynn Johnson and our Public Health Director, Paul Pettit. With hundreds of protests bringing the request for peace and respect, our reply is yes to all. We act in this manner. We support public safety and the rights of all citizens to be respected. Genesee County has worked quietly to provide food and nutrition daily to thousands of residents of all ages. Check-in calls, emergency provisions, and assistance without question. Our actions are our word of trust and truth. Protecting others is our civic responsibility, be it health, be it rights, or safety. Yes to all of the above. Phase 2 of our reopening is on track. It's a hot topic. Following the guidance is difficult, but our job is to support our public health department, whose responsibility it is to secure a safe and responsible but steady return to normalcy. And we would ask that your compliance, your continued patience will get us there faster together than by working against where we are with our guidance and our executive orders. Please hang tough with us, because we are hanging tough for you, our business partners, our community residents, and all of us together. Thank you. With that, Chair Johnson, I turn it over to you.
Thank you, Chair Stein. The process of reopening is frustrating at the very least, and we are at the mercy of the governor on how and when he wants to release information. Thank you to all the businesses in Genesee and Orleans County for your patience as we have gone through this process. And as we move toward phase 3, we will operate with caution as we look to open restaurants and other businesses and not assume that just because our numbers are good, we will automatically open. The governor is in charge. He makes the decisions, and that's how it works. I can assure you that we are fighting to keep everyone safe, and we are fighting to open businesses as soon as it's safe and legal to do so. On another note, that Chair Stein had mentioned too, racism is a public health threat. And that public health threat is very real. Each of us, every single day, has the opportunity to wake up and to choose love and kindness. There are some days that choice will be harder than others, but if we truly want to see the best of humanity restored, we must choose love. Hate and violence is not the answer, even when it seems justified, even when it seems like the only way. Our focus must not only be on today and staying healthy, but staying healthy tomorrow, and it's also on the future that we want to see. Violence never brings permanent peace. It solves no social problems. It merely creates new and more complicated ones. Violence is impractical because it is descending spiral ending in destruction for all, as we have seen on countless news reports. It is immoral because it seeks to humiliate the opponent rather than win his understanding, and it seems to annihilate rather than convert. Violence is immoral because it thrives on hatred rather than love. It destroys community, and it makes brotherhood impossible. It leaves society in monologue rather than in dialogue. And to quote Martin Luther King Jr., violence ends up defeating itself. It creates bitterness in the survivors and brutality in the destroyers. With that, I ask you to be safe, don't lose heart. We are stronger together, and stay healthy. Now I'd like to introduce Paul Pettit, our Public Health Director for both Orleans and Genesee County. Paul?
Thank you, Chairman Johnson and Chairman Stein, for your introductions. As always, full of a lot of great information and words of wisdom, and really do a great job of really setting the stage of what's going on in our communities and where we're at, from obviously the elected official perspective, and that kind of dovetails in nicely to the public health perspective that we continue to talk about on a weekly basis, and then we push out through our daily updates to you folks, which we hope you find informational. Again, we're trying to keep as much real-time information in those as possible, as it is very fluid. But we are here in the middle of phase 2. Obviously, last Friday we did just start phase 2, and we're halfway through at this point. The numbers continue to look very good, and very promising from what we're seeing both locally in Genesee and Orleans County, but also regional. And I did want to, as I start here, just take a second to thank the residents of Genesee and Orleans County and the businesses and the organizations for their continued effort in this time. It's just articulated again by our chairman. This is something that is not easy. It can be very challenging and discouraging to continue to appear to be at a very slow and methodical pace. Again, when we see other areas of the country and other businesses potentially opening up quicker. But it is something where we are, methodically moving through, and the numbers are looking good, as I said. Our bed utilization, our IC bed utilization are down. Positives are down overall. We've seen a lot more testing occurring, driven a lot by the nursing home testing requirements for staff. But again, overall, they're down. You've been seeing throughout the week only, in some cases, 0, 1, 2 cases. That's all we're seeing on a daily basis. Very little in the community. Our positive case percentages on the number tested are down. So again, things are looking very well. And that's why I want to continue to encourage folks to keep that optimism. Keep looking, up, keep looking positively towards where we're headed. We know there's a lot of frustration and angst. I've shared that week by week here on my perspective on some of these testing issues, swabbing sites. So there is a lot of concern in the community, and again, some angst to get us moving forward. And we are going forward again slowly and methodically. But again, we're continuing to advocate and push from my perspective on the public health side, where there's certain things that we feel maybe we can go quicker on. And we have seen movement. We did see obviously some changes with churches during phase 1. We saw this week changes with restaurants being allowed having outdoor seating in phase 2 when it wasn't allowed. So through that advocacy and pushing, we are able to affect change in some level. So that's always a good thing. So locally we are doing our best to advocate and push back and to really push forward when we can, when it makes sense. And we continue to see clarity on a lot of these different things where it just seems to be sometimes a black hole, and we're not really getting the answers we want. To inform the public, to inform the businesses, and we're doing our best to articulate that on a real-time basis as soon as we get it, to make sure that we're articulating and pushing that forward as best we can. All right, so I'm going to run through our current data for the day. We're going to be reporting in the press briefing that's getting released here, and run through a couple other highlights and then take questions. So for Genesee County, as of 2 p.m. today, we have 2 new positive cases of COVID-19 for a total of 192 cases. The new positive resides in Batavia. Both individuals reside in Batavia. One person is in their 30s and one is in their 40s. One of the positive cases was on mandatory quarantine prior to testing positive. 5 of the previous positive cases have recovered and have been released from mandatory isolation. Again, we'd like to see that number continue to go up. Which is a good thing, seeing folks in the recovered category. 0 of our total active cases in Genesee County are hospitalized. So let's jump over to Orleans County. We have 1 new positive case of COVID-19 for a total of 239 cases for Orleans. The new positive individual resides in the town of Yates. The person is in their 30s, and the new positive case was not on mandatory quarantine prior to testing positive. 3 of the previous community positives have recovered and have been released from mandatory isolation. And 16 of the total cases of hospitalization in Portland County of the active cases are hospitalized. Again, please note when we do report hospitalized cases, this is a mix of regulated and cases. We don't delve into the details of those to protect privacy. So again, 16 hospitalized in Portland County. So I'm going to run through some cumulative data as I typically do. So we're going to just share our online tracking tool as I go through this. So I don't know if we're going to bring that up. Is that okay? So that's up there. So again, for Genesee County, 194 positives. We've had 4,406 negative tests. We have 6 folks under mandatory isolation. As you can see, that number is down quite a bit. We've seen that number up in the 20s and 30s, even 40 3-4 weeks ago. So again, only 6 folks under mandatory isolation currently, 43 under mandatory quarantine, 5 total deaths in Genesee County, and now 132 recovered. Information related to the different phases, what businesses, what organizations, what categories fall into the different phases. When you get into the current phases where we are, there's a lot more detailed information there. There's guidance documents for all those categories. There's just a lot of information. There's an attestation page. There's also information around, the different tools and templates that are there that we've really been encouraging businesses to take a look at. These guidelines and templates are full of information to make sure that you have the latest information, all the types of different points that you need to make sure you're including in your reopening plans. Again, to make sure it's thorough and covers all the different required pieces that we want to have. So again, this is something for New York we want to continue to emphasize and steer folks towards. Use the template, again, customize it. Every place is different. Logistics as far as how you interact with your employees, how you interact with the public is different. So again, customize it, make it however you need to. But again, that's there as a resource. As a reminder, we are not reviewing plans at the health department level. Any plans that are done are meant to be kept on record. So within your organization, at your business, whatever it may be, you need to have those available if anybody asks for them, or they need to be produced for whatever reason it may be. Make sure you have those. But again, we are not reviewing them internally at the health department. We're not approving them. There is no mechanism or process for having that done. The requirement is that you have it. So again, with things being so rapidly changing, I would encourage you to get your plans done now. If you're not in phase 1 or 2 and you may be 3 or 4, get them done now so you're ready to go. Obviously with food service establishments, we saw this past week, they were allowed to open up outdoor seating. Again, that was not necessarily planned. We pushed for it and we were happy to see that it happened. But again, if the establishments weren't ready, then they weren't able to open the other day when that was allowed. So the underlying message here is monitor closely and be ready. All right, so just a few other things here. So again, per Governor Cuomo, gathering size, so this is groups, assemblies, meetings, etc., are still restricted to 10 or less. That executive order is still in place. So this is something that we want to clearly articulate. We've heard a lot of different things over this past week, from different social media being sent to us, from questions that, it's at 25, it's at 50, it's at 50% capacity. The reality is it is still at 10. The number 10 or less is still in place for at least June 21st. That's the date that order is potentially set to expire. Again, you could change that prior to that date. You could raise it up to a higher number. You could eliminate it. Obviously, you can do whatever he chooses with that. But June 21st is the minimum. Obviously, we'll see what he does from there if he decides to extend it longer, again, or if he wants to modify it. But we will, clearly articulate that again in our daily press briefing during these press updates on Friday, if and when that changes. But in the meantime, that's still the number we're looking at. So if we get calls or complaints, or again, people complain through the hotline, that's really that number for gatherings that is still in place. So a couple other things here. So graduation, obviously there was just some documents that were released yesterday around graduation and communicated that to all of our local school districts to make sure that they have that information and what's entailed in the guidelines. I've had many conversations with all of our superintendents over the last several months now, obviously going back to when we closed. We keep in regular contact, and I do want to acknowledge and thank all of them. They've done a great job with working with their schools, working with their board, working with all of the families and kids in their school over the last 3 months. It's been very challenging and difficult, and now as we head into typically the end of the school year, right, where we have the opportunity to celebrate and recognize specifically our seniors and all their accomplishments, all the different ceremonies and award banquets and obviously graduation that come with that. And it's, obviously a challenging time. They've missed out on a lot the last 3 months of their senior year. And, we are, again, trying to push and advocate for a little more relief than what's provided in these guidance documents. We do believe that there is a path and there is a way that, these ceremonies can be done in a safe way, keeping in mind social distancing and making sure that, obviously those the graduates and the families are safe and making sure that they're adhering to the guidelines and social distancing. But at the moment, what the governor has put out is the guidance, and that is what we've articulated to the schools. Again, that could change. It's very fluid as with everything. But we're encouraging them to plan, put in place, potentially backup plans, and hopefully we can, have some of recognition and celebrate with all of our graduates in our counties, which is what we all want to be able to do in obviously a safe way. So again, maybe some more changes coming with that. We'll see. But again, the schools have their documents, and we continue to advocate, push for some greater flexibility. But at the moment, again, the guidelines provide the path that the governor has approved at the moment. But more to come on that, and we'll be sure to articulate that and share that with our school districts. So again, phase 3 here, the earliest we're looking at, again, based on the governor's timeline, is next Friday, which will be June 12th. Again, that's at the earliest, and again, this is based on data as we've been reporting. It looks good. But the governor has this outside party reviewing data. Overseas experts reviewing this, looking at it. So, I can't give any definitive answer when phase 3 officially happened. Obviously, phase 1 happened at midnight. Phase 2 happened at 1 o'clock on Friday. So, basically until he, makes that final determination, we're still going to be in phase 2, and phase 3 will start after that. But again, be ready. You go forward if that comes. A couple other things. So New York State's still on pause, as we talked about. Again, the complaint line is there. There's a number. There's a website. Again, for large gatherings or businesses that may be opening or doing activities outside of their phase. Again, that's there and available if people choose to utilize it. Again, just a reminder here, we've been getting a lot of calls on the personal care service side this week. And, we know salons and barbers, et cetera, they were able to open in phase 2 last Friday. And there were restrictions put in place. So there's a lot of personal care activities that maybe go on in these facilities that were not allowed to open in phase 2. They're targeted for phase 3. So again, make sure you check that closely. If you happen to be one of those businesses, we have been, again, dealing with different concerns and complaints and just questions around this week. But again, the information on Ford, New York is very descriptive of what is allowed to be open right now and what is not. So again, refer to Ford, New York for guidance on that. Contact tracing continues to occur locally within our 2 health departments. We're primarily handling that through the health department, through the nursing and epidemiology staff. We're currently not necessarily utilizing New York State contact tracers at the moment. There's been a lot of publicity and advertising around this contact tracing team that the state has. And we may be utilizing them at some point in the future as, again, other activities open up and we lose our staff back to other public health duties. But at the moment, we are, basically doing all the initial investigation and contact tracing through the health department. But just be aware, if that does flip over and we start using the New York State contact tracing program, you may be getting contacted by someone not from the health department. I mean, they're going to identify themselves as a New York State contact tracer, and they will be working with us locally. It's a partnership that we would have with them, where we would do the case investigation and we would turn over the daily monitoring and the follow-up to this group to do the follow-up contact tracing over the course of the isolation and quarantine period. Just wanted to make sure everybody was aware of that. So my understanding is these phone calls will be coming in and being checked, and it would show up potentially as New York State or some level of identification of the caller. But we'll be sure to communicate that to folks as we move along, if and when we start utilizing them for our contact tracing purposes. Again, swabbing, continues to be very limited. Not too much change in our counties from last week. We have identified a few other locations. So URMC, so strong URMC health system, their providers are now doing antibody testing. So again, if you happen to be a patient of facility on Liberty Street there in the city or over in Leroy, those facilities are now doing antibody testing, but you have to be a patient of theirs. It's not for community general walk-ins, but that is available. So that is another access point for antibody testing. And then we're also made aware that CVS over in Brockport, just over the border here in Orleans County, is also doing COVID-19 testing. So again, a little bit more movement on that. We continue to talk to pharmacies locally. We continue to talk to other agencies, and we're really pushing the State Department of Health to open up some level of capacity within our 2 to 3 counties, especially with the new mandates coming down for, again, hair salon, barbers, et cetera, to have tested twice a week. We don't believe it's necessarily appropriate to put these mandates in place and not have the local capability for these folks to get tested in a reasonable way and a timely way. So we are advocating and pushing back on that. Hopefully we'll be able to get some movement here shortly. Also, again, when you do get the links, on our daily press briefing, there's a lot of information there on for New York, the regional control room, the business lookup tool that we mentioned, obviously information on the COVID-19 testing tracker that just went through, not a lot locally, but obviously around us regionally, it is there with different testing sites. Mask and face coverings from the county side, we still do not have a large availability through emergency management to hand out. We did have a period, a week and a half, 2 weeks ago, where we did disperse a lot of those. So at the moment, again, not a large supply coming from us from the government side, but utilize anything you may have. Again, it's face covering, so a lot of folks have been making their own and being creative with that. But again, more information will be released if and when we have that available. Again, just a reminder on the ROC COVID-19 health screening tool. Again, that is available for folks to sign up if they would like to daily report their symptoms into that. Again, another tool for us on the public health side to monitor potentially trending in the zip codes if we start to see a lot of activity. Last thing as I wrap up here before questions is typically what I like to do is, again, push on the mental health side of things. Again, it's very important that folks know that there is outlets. They're not alone. Have been kind of really ratcheted down, and people have been isolated. We've heard a lot of the cases and concerns around anxiety, and depression and other such things. So it's very important to continually remind folks that there is help. We have our behavioral health, mental health departments in both counties available. There's private services. There's other therapists that are available within our region and local. So we would encourage everybody, if they need that, to make sure they reach out and get the help. Don't be alone. Don't be frustrated and scared and alone. So again, the Care and Crisis Helpline is available 24/7. So if you need that service again after hours, there's always someone there. So, all right, that's it with the highlights of the week with COVID-19 here locally, from my perspective, anyways. So we're gonna open it up to the media that's on the phone right now. And again, as we do every week, if you do have questions, make sure you identify who you are and what the news agency you may be with. And I will do my best to answer the question you may have. If I don't have the data or the information, we'd be happy to research that and get that back to us. Okay. So with that, we can open it up.
Hi, Paul. This is Howard Owens from the Batavian. Can you hear me?
Howard, how are you today?
Could you hear me?
Yep. Can you hear me?
Yep.
All right.
So, good to see you. You talked about gatherings, and as you know, there's been protests taking place in other communities. There's one scheduled for here, And, one of the comments I see repeatedly on social media is, what about this 10 limit? How are they being able to do these protests that exceed the 10-person limit? Maybe above your pay grade, but I just wanted to give you a chance to address that. What would you say to those people that raise that question?
Yeah, I mean, that's a great question. I've been doing my best to try to answer that all week. And, it's challenging. I mean, it's logically hard to rationally give a answer to that. Obviously, people have the right to gather, to protest, and, want people to have their civil rights. And it's challenging in this environment with, the virus transmitting, still transmitting at lower levels. And I think the best thing we can offer right now is if you are going to partake and attend these events, wear your mask, wear your face covering, do whatever you can to make sure you're protecting yourself and protecting others. It's not an ideal situation. We're yet to see potentially what the outcome of all these gatherings are around the country and here in New York State. As we talked about from day one here, there's a 14-day incubation period with COVID-19. So really any potential spread and significant spread as a result of all this close contact, potentially could be starting to show up this weekend into next week. So again, I can't really justify or explain the difference here beyond, we do know that, when you do get large gatherings, the percentage of increase of someone being positive for COVID increases. And, there are different levels of, effectivity and, how contagious people may be. And there's a high likelihood if, again, this close contact occurs and there is someone that's infectious, that it could be spread around. And as we know, the governor, the way he has this reopening set up, it's tied to data and the numbers. And again, we've shared today that they are trending in a great direction. We need to see the numbers where we want to see locally and regionally. And we're on a good path. And the last thing we want to do is see that somehow altered. And now we're in a position where all of a sudden our numbers are spiking in the wrong direction, and it unintendedly back on pause. So the best thing I can offer is, if you are going to partake in these activities, do your best to, protect yourself, protect others, wear the face coverings, and try to maintain your 6 feet separation.
Great, thank you, Paul. And the other thing is, I've talked to a few business owners this week. I don't know if you saw one of the interviews I did. Feedback I'm getting is 19 pages of what is called guidance, but business owners are taking it as regulations. And they think that, for a lot of these business owners, they're not experts in this stuff. It's hard for them to muddle through, these small business owners. They don't feel confident sometimes in what they have to deal with. And they sometimes feel like some of the instructions or the guidance is conflicting. What resources are there to help them understand exactly what they should be doing, and can they call county health to get questions answered?
Yeah, absolutely. Don't get me wrong when we say, we're not reviewing plans and the difference between that and technical guidance. We're happy to talk to any of our constituents and anybody that, is in our community and needs help and guidance. I have folks all day long answering calls and trying to provide guidance. Again, we're very limited in the number of folks we have, so it's not like we can, customize and have intimate, long talks with every organization in business. But if folks have specific questions on something in the guidance, something that's not clear to them, they just need some additional clarification. We're happy to do that. We don't want our folks, overly frustrated trying to maneuver through this process. The overall general guidelines, are fairly nuanced, I guess, but they get into some specific details when it gets down into each different type of discipline. And no, we're happy to talk. Give the office a call, and we'll do our best to try to walk you through whatever questions you may have. Again, we're not going to formally review the plans, and we're not going to approve them, but we're happy to provide technical guidance and assistance all the time. That's what we're here for. We're a local resource, and we try to provide the most accurate, factual information we can.
And then a follow-up question that you may or may not be able to answer, but I heard this from a few local business owners, is they worry about liability and what their liability is and how they can be shielded from liability, or are they? Do you know anything about that? Can you address that issue?
Well, so as far as just general operations, I mean, everybody should have their insurances and those things that are provided. The one thing that we've been really trying to caution folks on, if you move outside the governor's guidelines and executive orders, that's the area that's really this unknown. When we talk about phase 1, 2, 3, 4, where you fall in, and if you happen to potentially open prior to when you're, authorized within the guidance, we don't know what potentially liability is there if you happen to say open your establishment early and there's an issue. There could be some liability issues there. We encourage everybody to make sure you contact, potentially your insurance carrier, et cetera, to see what the impact could be if essentially by an executive order you're supposed to be closed and you're open. So those are some gray areas that we don't really have good answers on, but we definitely want to articulate and caution folks, to really think through your approach and what you plan on doing, because the last thing we want is businesses, et cetera, to be harmed further, potentially by moving and doing stuff outside of what is allowed. But again, we can't speak specifically to that, but we would encourage folks to investigate that prior to opening and or doing anything outside the order.
Great, Paul. Thank you. Have a great weekend.
You too. Thanks, Howard. Any other questions from the media? Okay. All right. Well, so we'll wrap this up. Again, I want to thank everybody for joining in, and we're going to continue to push out information. And again, as we move along, it's fluid. Follow Forward New York for the most current information. And as we head into this weekend with some nice weather forecasts, and again, we ask that everybody do it responsibly, do it safely, and get out and enjoy some of the nice weather. And we'll be talking soon. So have a great day. Thanks.